Well, we were just laughing this morning about the good old days of braces. When I got my teeth straightened originally, it was a mouthful of metal, and honest to goodness, in my 20s, I was wearing that headgear at night. Okay, things have changed completely. Dr. Paul Coleman is here with us this morning to talk about the latest in getting your teeth straightened. And he and I were laughing about the fact that the last time we talked about Invisalign, you actually had the Invisalign apparatus on, and I couldn't even see it. I didn't even know you had it on.
Halfway through the interview, we popped it out.
Popped it out of your mouth.
I love the look on your face.
Are you wearing it now?
No,
no, you're not. Okay. All right. Invisalign is revolutionary. A lot of people have heard about it, but I don't think they quite understand how it works or how simple it really is.
Okay. Well, I can explain that fairly simply. Basically, all you have to do is get an impression of the patient's teeth, and we send it to the lab. And then the lab technician and he works with a graphics program. They never even pour up the impression. They CAT scan it. And their program then figures out how you can move the teeth with a series of what we call aligners. They're a little clear plastic tray that just slips over your teeth, and they're designed over a 2-week period of time to move each individual tooth that needs correction 0.2 of a millimeter. So you wear it for 2 weeks,
right,
and then you go to the next in the series of aligners. So some patients get 6 sets of aligners, and that lines them up. Now what's kind of cool is at the very beginning of this, the technology is unbelievable. They actually send me something called a ClinCheck, which is like a graphics cartoon. And you can see every 2-week period how this tooth does this and this and this. And if you just fast forward it, it looks like a movie with the teeth go, and at the end of this, so you can actually track. I had a patient in yesterday, and she goes, "Can I see what's supposed to be occurring by this point in time?" Because she notices difference in the mirror. I said, "Sure." So we popped up the ClinCheck, and she's sitting there watching it, and she's going, "Oh yeah, that's exact. Oh yeah, I can see how that tooth turned around." And
now that
it's
probably
very
really helps,
simple.
As a doctor, that really helps in the explanation of what's going to happen, because I remember, like I said, the good old days with all that metal in my mouth, all I knew is things were being twisted, and it was really uncomfortable. And this couldn't be more comfortable.
This is unbelievable. The patient who was in yesterday, what I do is when I deliver it, most of the changes during the 2-week period of time happen in the first 48 hours. And the only time where you might have a little discomfort is the first one you put in, because that sort of gets things rocking and rolling a little bit. So what I actually have people do, they don't even wear them out of my office. They say, "Go home, take 2 Advil, hop into bed." She said that she woke up the next morning and she slept through the night. There was no discomfort. She's had absolutely no problems at any point during the treatment. She's now 3 months in.
You know, I'm thinking of all the advantages just compared with my experience. You know, the old headgear, and you had the wax that you had to put in there over the brackets because they were rubbing on your cheeks. This is all perfectly smooth and, as the name implies, invisible.
Well, I actually had one of my first patients was a guy about my age, and he bought a bottle of champagne, and he was working down at UCSD, and he said, "You know, the first person that looks at me and says, 'Hey, you do something with your teeth,' he goes, 'I'm going to give him the bottle of champagne.'" And so he got the end of his treatment, and no one had noticed it, so he drank the bottle himself.
Himself to celebrate. Well, folks, we've been putting up some before and afters up here and letting you have just a little look at this. But, boy, I really suggest you come in and see Dr. Paul Coleman and get a consultation on this and talk about how Invisalign can work for you. Now, another thing that might have been a fallacy, a misconception that people were suffering under, is that, well, this is really for very limited cases. That is not true.
No, you can do 90% of the cases that you could do a traditional ortho with this. In fact, there's an Invisalign orthodontist up in Anchorage who does every case that comes in his office with Invisalign. So there's really no reason that you have to go through. And the other advantage to this, if you want to brush, floss, it's not a big hygiene trap. You just pop them out, you brush normally, you eat normally, pop them back in.
What another great point. I mean, with the old bands like I had, you always had to be worried about discoloration, the bands popping off. You had to worry about trying to floss in between there.
Well, not only that, but one of the reasons that people should consider doing this, even as adults, you have some hygienists in your family,
yes,
okay?
My wife's a dental hygienist.
And
she's actually done some of this and said it's just amazing.
Well, if you have teeth that are crowded, how much of the tooth can't you get at, or your hygienist? So you get bugs percolating down in the holes like termites in the cellar, kind of eating problems away and eating bone away. But if your teeth are straight, the reason to do this is not necessarily just for appearance, though that's kind of a free benefit.
Right.
But the other part of it is if teeth are straighter, they're easier to maintain, the gum's easy to maintain, and one of the constant battles we have as adults is gum disease. So the straighter the teeth, the easier it is for you to keep your teeth for life.
Absolutely. Hey, Dr. Paul Coleman, it's always great to see you. Invisalign is the treatment. We'd love folks to come out and talk to Dr. Coleman. Invisalign Day, in fact, is October the 6th from 7 a.m. to 4 p.m. And how do you want folks to do this, Doctor?
Actually, give my office a call. October 6th. I'm a little less than the average fee. I'm $5,100, frankly. But we're giving $750 off. I'll do all the x-rays and photos and everything for free, which is another $250. We'll bleach your teeth at the end of it, which is another $350. And I arrange specialized financing so you can do the whole thing for under $200 a month for 2 years, no interest.
You can't beat that. So go see Dr. Paul Coleman. Give him a call right now and get your reservation in for Invisalign Day. It's good to see you, my friend.
Good to see you again.
All right. For more information, you go to san diego6.com and you click on San Diego Living.